Hello, we have Dr. Jaggi Rao here, dermatologist from US as well as Canada. We had a couple different questions in regards to Dr. Rao's experience with melasma, but first off, Dr. Rao, how long have you been using the Sciton?
Been using it for about 7 years.
Outstanding. And what type of modalities do you have?
I have the profractional laser, I have the micro laser peel, I have the BBL, I have an ND-YAG.
One of the biggest indications that we actually just got done, or you got done talking about, was melasma, or is melasma, and we'd love to hear kind of your thoughts on the treatment of melasma, what your treatment of choice would be.
Well, I think for melasma there's two principles that you have to follow. The first is to prevent further pigment gain, and the second is to promote pigment loss. And if you're going to promote pigment loss, there's no better way to do that than using a fractionated erbium YAG. The reason for that is that there's very minimal collateral spread of heat, and you're creating a very pure channel to not only ablate some of the pigmentary tissue, but you're also allowing for a channel that would allow for transepidermal elimination of the pigment itself. It works very, very well. You can reduce your treatments by numerous fold.
There are many other options out there with different technologies. If you don't mind explaining why you like the profractional with Sciton versus some of these other technologies that you have had experience with.
Yeah, I've had experience with both ablative and non-ablative resurfacing, especially when it comes to fractional lasers. I find that the non-ablative lasers, although they do have the ability to help melasma a little bit, they don't create an actual channel to allow for the transepidermal elimination, so that's where they fall short. The other ablative lasers, such as the YSGG laser, ablative laser, as well as the CO2 fractionated laser, unfortunately create a little bit too much heat, collateral heat, and not only does it not help melasma, sometimes it can make it worse.
Now, there's a lot of papers out there that claim Q-switch is one of the most superior lasers for treating melasma. What are your thoughts on that? And then also with, once again, comparing it to profractional.
Q-switch laser technology is pretty amazing technology for tattoos, and it's good for superficial pigment. The problem is when the melasma is deep, then you run into a little bit of a problem. In some cases, it can make the melasma even worse, simply because there's a lot of heat that's being generated in and around the dermal epidermal junction that can cause post-inflammatory pigmentation, especially in darker skinned people where we do see melasma most commonly. It's better instead to create a very clean channel, such as what we have with the fractional laser, in combination with other modalities such as lightening agents.
Great. Well, thank you very much, Dr. Rao. We really appreciate your time today.
It's a pleasure. Thank you.